Hello, so today we'll be discussing about the inflammations of ear canal part 3, and we'll be dealing about the malignant necrotizing otitis externa, which is the last part of the bacterial inflammation. Okay, now it is caused by the pseudomonas infection and it is usually seen in the early diabetics or under immunosuppressant drugs. Okay, now what are the clinical features? In the early stages, it will be resembling the diffuse otitis externa, but there will be excruciating pain and granulations in the external canal. Okay, now this condition is most commonly associated with facial paralysis. Okay. Now, if the symptom or the condition, if it spreads to the skull base and jugular foramen, there will be cause of multiple cranial palsies. Okay. Now, how can we diagnose this condition? So, definitely these symptoms can be a reason, and we can use the other investigation methods like CT and MRI, and it may reveal bony destruction and soft tissue involvement extension. Okay. Now, what are the treatment? Definitely there should be a control of diabetes and ear toilet methods and antibiotic treatment. Okay, so that marks the end of the bacterial inflammations of ear canal. Now moving to the fungal inflammations of the ear canal. So this is called by the Otomycosis. Okay, so it is usually caused by the Aspergillus niger, fumigatus and Candida albicans. Now what are the clinical features? So there will be intense itching, which will be told by the patient, and there will be watery discharge with a musty odor. So this is a differentiating feature, and there will be ear blockade as well. Okay, now definitely on otoscope we can elicit a fungal mass which can be white, brown and black, which resembles a wet piece of filter paper. Okay, now we can differentiate which causative organism is causing these color. Okay, now let's see that. So if it is Aspergillus niger, it will be black-headed filamentous growth. If it is fumigatus, it will be pale blue and green in color. Now if it is caused by Candida, it will be white and creamy. And of course the meatal skin we have to check through. So it will be sodden, it will be red and edematous. Okay, now what will be the treatment? Of course ear toilet methods, which is very common for all kind of inflammations in the ear canal. Okay, then antifungal creams and antifungal treatment, because of course it is a fungal infection, so we have to consider that also. And definitely if there is a secondary infection of a bacteria, we can consider the involvement of antibiotics in the treatment protocol. So hope you got an idea about the active inflammations, that is infective inflammations of external auditory canal. Thanks for watching.